Question 1. Which of the following is a common characteristic of a preferred provider organization, PPO, plan? A. Requires a referral from a primary care physician to see a specialist. B. Typically has lower out-of-pocket costs compared to other managed care plans. C. Allows members to seek care from in-network or out-of-network providers. D. Focuses primarily on preventative care with limited coverage for other services. Answer: C. Allows members to seek care from in-network or out-of-network providers. Explanation: a PPO plan gives its members the flexibility to choose their healthcare providers, whether they are within the plan's network or not. While seeing an in-network provider usually results in lower costs, members are not restricted to these providers and do not typically need a referral to see a specialist. This freedom of choice is a defining feature of PPOs, offering more control over healthcare decisions but often at a higher premium than plans with more restrictions. Think of the preferred in PPO as meaning you get better cost benefits when using their network, but the organization allows access outside it. Question 2. What is the primary purpose of the coordination of benefits, COB, provision in a health insurance policy? A. To ensure that all healthcare services received by a policyholder are covered. B. To determine which insurance plan pays first when a policyholder has coverage under more than one plan. C. To allow policyholders to choose which insurance plan will be their primary coverage. D. To reduce the overall premiums paid by policyholders with multiple insurance plans. Answer: B. To determine which insurance plan pays first when a policyholder has coverage under more than one plan. Explanation: coordination of benefits is crucial when an individual is covered by more than one health insurance plan to avoid overpayment of claims. This provision establishes the order in which each plan will pay, ensuring that the total benefits received do not exceed the actual expenses incurred. For example, if someone has coverage through their employer and their spouse's employer, COB rules dictate which plan is primary and which is secondary. Remember, COB helps prevent someone from making a profit from their health insurance coverage. Question 3. Which of the following types of health insurance plans is known for having a high deductible and the option to save for healthcare expenses with a tax advantage? A. Health Maintenance Organization, HMO. B. Preferred Provider Organization, PPO. C. High Deductible Health Plan, HDHP. D. Exclusive Provider Organization, EPO. Answer: C. High Deductible Health Plan, HDHP. Explanation: a high deductible health plan, HDHP, is characterized by a higher deductible compared to traditional health insurance plans. This means the insured pays more out-of-pocket before the insurance company starts to pay. A key feature often associated with HDHPs is the ability to contribute to a health savings account, HSA, which offers tax advantages for saving and spending on qualified healthcare expenses. The higher deductible is balanced by the potential for tax savings and greater control over healthcare spending. Think high deductible, health savings. Question 4. What is the term for a fixed dollar amount that an insured person must pay out of pocket each time they receive certain healthcare services, such as a doctor's visit or prescription? A. Deductible. B. Coinsurance. C. Copayment. D. Premium. Answer: C. Copayment. Explanation: a copayment, often simply called a copay, is a set fee that the insured pays for specific healthcare services. Unlike a deductible, which is a total amount paid before coverage kicks in, or coinsurance, which is a percentage of the cost, a copay is a fixed amount paid each time a service is used. For example, a person might have a $20 copay for a visit to their primary care physician. Here's an easy way to remember: copay means you co-share the payment each time you use a service. Question 5. Which of the following is a typical characteristic of a health maintenance organization, HMO, plan? A. Offers the most flexibility in choosing healthcare providers. B. Typically has higher premiums compared to other managed care plans. C. Requires members to choose a primary care physician, PCP, within the network. D. Provides coverage for out-of-network services without a referral. Answer: C. Requires members to choose a primary care physician, PCP, within the network. Explanation: HMO plans generally require members to select a primary care physician, PCP, who acts as their main point of contact for healthcare needs and provides referrals to specialists within the HMO network. This coordinated care approach helps manage costs and ensures that members receive appropriate care. While HMOs often have lower premiums and out-of-pocket costs, they typically offer less flexibility in choosing providers compared to other plan types. Remember, with an HMO, your PCP is often your first step for most healthcare needs. Question 6. What is the waiting period in a health insurance policy? A. The time between applying for coverage and the policy becoming effective. B. The period after an injury or illness occurs before benefits are payable. C. The duration of the insurance policy before it needs to be renewed. D. The time a policyholder must wait before being eligible for certain types of care, such as maternity benefits. Answer: D. The time a policyholder must wait before being eligible for certain types of care, such as maternity benefits. Explanation: a waiting period in health insurance is a specific duration of time that must pass after coverage begins before certain benefits become available. This is common for services like maternity care or organ transplants to prevent individuals from purchasing insurance only when they anticipate needing expensive services immediately. It's important to understand these waiting periods when selecting a health insurance plan, especially if you foresee needing specific types of care in the near future. Think of it as a waiting period before certain benefits are available. Question 7. Which of the following best describes the purpose of the annual deductible in a health insurance plan? A. It is the fixed amount a policyholder pays for each healthcare service received. B. It is the percentage of healthcare costs a policyholder pays after the insurer pays its share. C. It is the total amount a policyholder must pay out of pocket for covered healthcare services before the insurance company begins to pay. D. It is the regular payment a policyholder makes to maintain their insurance coverage. Answer: C. It is the total amount a policyholder must pay out of pocket for covered healthcare services before the insurance company begins to pay. Explanation: the annual deductible is the specific dollar amount that the insured person must pay for covered healthcare services within a year before their health insurance plan starts to pay its share of the costs. Once the deductible is met, the insured typically pays a copay or coinsurance, and the insurance company covers the remaining eligible expenses. Consider it your initial responsibility each year before your insurance benefits fully kick in. Question 8. What is the role of coinsurance in a health insurance plan? A. It is a fixed fee paid by the insured for specific healthcare services. B. It is the total amount the insured must pay before the insurance company starts to cover costs. C. It is the percentage of covered healthcare costs that the insured pays after meeting their deductible. D. It is the regular payment made by the insured to maintain their insurance coverage. Answer: C. It is the percentage of covered healthcare costs that the insured pays after meeting their deductible. Explanation: coinsurance is the portion of the medical expenses that the insured person is responsible for paying after they have met their annual deductible. It's usually expressed as a percentage, such as 20%. For example, if your plan has an 80/20 coinsurance, the insurance company pays 80% of the covered costs, and you pay the remaining 20%. Remember, coinsurance kicks in after you've paid your deductible. Question 9. Which of the following is a key characteristic of an exclusive provider organization, EPO, plan? A. Allows members to see out-of-network providers at a higher cost. B. Requires a referral from a primary care physician to see a specialist. C. Provides coverage only if care is received from providers within the EPO's network, except in emergencies. D. Typically has the highest premiums among managed care plans. Answer: C. Provides coverage only if care is received from providers within the EPO's network, except in emergencies. Explanation: An EPO plan requires members to receive healthcare services from providers within the plan's network to have coverage, except in emergency situations. Unlike PPOs, there is typically no coverage for out-of-network care, and unlike HMOs, a primary care physician referral is usually not required to see a specialist within the network. The exclusive in EPO emphasizes the in-network only aspect for non-emergency care. Question 10. What is the maximum out-of-pocket MOP in a health insurance plan? A. The highest premium a policyholder will pay in a year. B. The total deductible amount for all family members on a plan. C. The limit on the total amount a policyholder will pay for covered healthcare services in a plan year. D. The maximum amount an insurance company will pay for any single medical procedure. Answer: C. The limit on the total amount a policyholder will pay for covered healthcare services in a plan year. Explanation: The maximum out-of-pocket MOP is a protection for the insured, setting a limit on the total amount they will have to pay for covered healthcare services in a plan year. This limit includes deductibles, copayments, and coinsurance but does not typically include premiums. Once this limit is reached, the insurance company will generally pay 100% of the covered medical expenses for the rest of the year. The MOP helps provide financial predictability for healthcare costs. Question 11. Which of the following describes the purpose of prior authorization in health insurance? A. It is a process for submitting medical claims after a service has been rendered. B. It is a requirement to obtain approval from the insurance company before receiving certain healthcare services or medications. C. It is a notification to the insured about changes in their premium or coverage. D. It is a review of medical records to ensure the accuracy of billing codes. Answer: B. It is a requirement to obtain approval from the insurance company before receiving certain healthcare services or medications. Explanation: Prior authorization, also known as pre-authorization or pre-certification, is a process where the insured or their healthcare provider must get approval from the insurance company before certain medical services, procedures, or medications will be covered. This is often required for more expensive or non-emergency treatments to ensure they are medically necessary and appropriate. Failing to obtain prior authorization can result in the insurance company denying coverage for the service. Think of it as asking for permission beforehand. Question 12. What is the primary difference between Medicare and Medicaid? A. Medicare is primarily funded by state governments, while Medicaid is federally funded. B. Medicare is a health insurance program mainly for people age 65 or older and certain younger people with disabilities or specific diseases, while Medicaid is a joint federal and state program providing healthcare coverage to low-income individuals and families. C. Medicare coverage is generally more comprehensive than Medicaid coverage. D. Medicare beneficiaries typically have lower out-of-pocket healthcare costs compared to Medicaid recipients. Answer: B. Medicare is a health insurance program mainly for people age 65 or older and certain younger people with disabilities or specific diseases, while Medicaid is a joint federal and state program providing healthcare coverage to low-income individuals and families. Explanation: The fundamental distinction between Medicare and Medicaid lies in their eligibility criteria and funding sources. Medicare is primarily a federal program based on age or disability status, while Medicaid is a needs-based program funded jointly by federal and state governments to provide healthcare to those with limited income and resources. Understanding these different target populations and funding structures is key to differentiating the two programs. Question 13. Which part of Medicare helps pay for inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care? A. Part A. B. Part B. C. Part C. D. Part D. Answer: A. Part A. Explanation: Medicare Part A is often referred to as hospital insurance because it primarily covers inpatient hospital stays, skilled nursing facility care, hospice care, and some home healthcare services. Most people do not pay a monthly premium for Part A if they or their spouse have worked and paid Medicare taxes for a certain period. Remember A for hospital. Question 14. Which part of Medicare helps pay for doctor's services, outpatient care, and preventive services? A. Part A. B. Part B. C. Part C. D. Part D. Answer: B. Part B. Explanation: Medicare Part B is known as medical insurance and helps cover services from doctors and other healthcare providers, outpatient care, home healthcare, durable medical equipment, and many preventive services. Most people pay a monthly premium for Part B. Think of B for doctor's bills. Question 15. What is Medicare Part D? A. A type of Medicare Advantage plan offered by private insurance companies. B. A program that helps pay for prescription drugs. C. Coverage for inpatient hospital stays and skilled nursing facility care. D. Coverage for doctor's services and outpatient care. Answer: B. A program that helps pay for prescription drugs. Explanation: Medicare Part D is the component of Medicare that provides coverage for outpatient prescription drugs. It is offered through private insurance companies that have contracted with Medicare. Individuals with Medicare can choose to enroll in a Part D plan to help lower their prescription drug costs. Remember, D for drugs. Question 16. What is the purpose of the Health Insurance Portability and Accountability Act, HIPAA? A. To regulate health insurance premiums and ensure affordability. B. To protect the privacy and security of individuals' health information. C. To establish national standards for electronic health records. D. To expand Medicaid eligibility to more low-income individuals. Answer: B. To protect the privacy and security of individuals' health information. Explanation: The primary goal of the Health Insurance Portability and Accountability Act, HIPAA, is to protect the privacy and security of individuals' protected health information, PHI. HIPAA establishes rules for who can access health information and how it can be used and disclosed. This helps ensure that patients' medical records and other health-related data are kept confidential. Think HIPAA as keeping your health information private. Question 17. Which of the following is typically not a covered benefit under most basic health insurance plans? A. Routine doctor visits for illness. B. Emergency room services for accidents. C. Elective cosmetic surgery. D. Prescription medications. Answer: C. Elective cosmetic surgery. Explanation: Most basic health insurance plans are designed to cover medically necessary services for treating illness or injury. Elective cosmetic surgery, which is typically performed to improve appearance rather than for a medical need, is generally not covered. While some plans may offer prescription drug coverage, it's often a separate benefit or under a different part of a comprehensive plan. Routine visits and emergency care are usually included in standard coverage. Question 18. What is the purpose of a health savings account, HSA? A. To provide tax-free funds for retirement healthcare expenses. B. To offer a way to save and pay for qualified medical expenses with tax advantages. C. To supplement Medicare coverage for long-term care costs. D. To allow individuals to invest in healthcare companies. Answer: B. To offer a way to save and pay for qualified medical expenses with tax advantages. Explanation: A health savings account, HSA, is a tax-advantaged savings account that can be used for qualified medical expenses. It is available to individuals enrolled in a high-deductible health plan, HDHP. Contributions to an HSA are often tax-deductible, the funds grow tax-free, and withdrawals for qualified medical expenses are also tax-free. This makes it a valuable tool for managing healthcare costs. Remember, an HSA pairs with a high deductible plan and offers tax benefits for healthcare savings. Question 19. Which type of healthcare service focuses on preventing illnesses and promoting overall health? A. Tertiary care. B. Secondary care. C. Primary care. D. Preventative care. Answer: D. Preventative care. Explanation: preventative care aims to keep people healthy and prevent illnesses or catch them early. This includes services like vaccinations, routine checkups, screenings, like mammograms and colonoscopies, and health education. The goal is to proactively manage health and reduce the likelihood of more serious health issues arising. Focusing on staying healthy is the core of preventative care. Question 20. What is a common way that individual health insurance policies are obtained? A. Through employer-sponsored group plans. B. Directly from an insurance company or through a broker. C. As a benefit provided by a government social security program. D. Automatically upon becoming a legal resident of a state. Answer: B. Directly from an insurance company or through a broker. Explanation: individuals who do not have access to health insurance through an employer or a government program typically purchase individual health insurance policies directly from an insurance company or with the help of an insurance broker. These policies are designed to provide coverage for individuals and families and can be purchased through the health insurance marketplace or directly from insurers. This gives people options to secure coverage tailored to their needs. Question 21. What is the definition of a pre-existing condition in health insurance? A. A medical condition that requires prior authorization before treatment. B. A health issue for which the insured received medical advice, diagnosis, or treatment within a specified period before their health coverage started. C. A condition that is excluded from coverage under a specific health insurance policy. D. A medical condition that develops after the health insurance policy has been in effect for a certain period. Answer: B. A health issue for which the insured received medical advice, diagnosis, or treatment within a specified period before their health coverage started. Explanation: a pre-existing condition is a health problem that existed before the start date of an individual's health insurance coverage. Under the Affordable Care Act, ACA, in the U.S., health insurance companies are generally prohibited from denying coverage or charging higher premiums based on pre-existing conditions. Understanding this term is important because it relates to what health issues are covered when a policy begins. Question 22. Which of the following describes the benefit of having health insurance with a low deductible? A. Lower monthly premiums. B. Paying less out-of-pocket for healthcare services before coverage begins. C. A wider network of available healthcare providers. D. More coverage for preventative care services. Answer: B. Paying less out-of-pocket for healthcare services before coverage begins. Explanation: a low deductible means that the insured individual has to pay a smaller amount out-of-pocket for covered healthcare services before their insurance plan starts to pay. While plans with low deductibles often have higher monthly premiums, the advantage is that you reach your coverage benefits sooner when you need medical care. If you anticipate needing frequent medical services, a lower deductible might be beneficial. Question 23. What is the purpose of the Affordable Care Act, ACA? A. To provide healthcare coverage exclusively for senior citizens. B. To reform the health insurance market and expand health coverage to more Americans. C. To eliminate private health insurance companies and establish a single-payer system. D. To focus solely on lowering the cost of prescription drugs. Answer: B. To reform the health insurance market and expand health coverage to more Americans. Explanation: the Affordable Care Act, ACA, also known as Obamacare, was enacted with the primary goals of expanding health insurance coverage to more people in the United States, reforming the health insurance market, and controlling healthcare costs. Key provisions include the individual mandate, now repealed, the expansion of Medicaid eligibility in some states, and regulations on insurance practices like coverage for pre-existing conditions. The ACA aimed to make healthcare more accessible and affordable. Question 24. Which of the following is a potential consequence of intentionally misrepresenting your health history when applying for health insurance? A. Immediate approval of coverage with lower premiums. B. Denial of coverage or rescission of the policy. C. Guaranteed coverage for all pre-existing conditions without waiting periods. D. Eligibility for additional government subsidies to lower out-of-pocket costs. Answer: B. Denial of coverage or rescission of the policy. Explanation: intentionally providing false or incomplete information about your health history on a health insurance application is considered misrepresentation or fraud. Insurance companies rely on accurate information to assess risk and determine premiums. If a misrepresentation is discovered, the insurer may deny coverage from the start or even cancel, rescind, the policy. Honesty and accuracy when applying for insurance are crucial. Question 25. What is a common reason why a health insurance claim might be denied? A. The service received was a routine checkup with a primary care physician. B. The insured has already met their annual deductible for the plan year. C. The service received was not considered medically necessary by the insurance company. D. The insured paid their monthly premium on time. Answer: C. The service received was not considered medically necessary by the insurance company. Explanation: insurance companies typically cover healthcare services that are deemed medically necessary, meaning they are appropriate and required for the diagnosis or treatment of a medical condition. If a service is considered experimental, cosmetic, or not necessary for the patient's health according to the insurer's guidelines, the claim may be denied. This highlights the importance of understanding what your health plan covers and sometimes obtaining prior authorization for certain procedures.